Hello, and welcome to Healthcare IT Today, where we explore the latest healthcare technology trends and discover valuable insights in health IT. I'm Colin Hung, and today I am joined by Anisa Tootla, Executive Director at AHIMA Foundation. Anisa, welcome to the program.
Oh, thank you, Colin. Great to be here.
I'm excited to talk to you because I was just recently at the AHIMA 21 virtual conference, which I enjoyed. I also enjoyed the year before. And during that conference, I learned a little bit about what the AHIMA Foundation was doing and the initiative that you have. And I'm so glad you were able to come on the show today to talk a little bit more about it.
Great. Glad to be here. Thanks for having me.
So let me start by asking this question. Can you maybe give our viewers and our listeners just a brief background of AHIMA Foundation and how it's related to AHIMA itself?
Sure. So the AHIMA Foundation was established as the charitable arm of the American Health Information Management Association. The foundation was established back in 1997. And it has focused on research and also the training of health information management professionals. So as the healthcare industry has really evolved and more resources and energy have been put into information sharing and access, we really did recognize in the foundation an opportunity to really broaden our mandate. And, as a C3 a charity, we have a public benefit mandate. And one of the most significant gaps in information sharing really is the consumer's ability to consistently access, understand, and use their health information with confidence, might I add. So it's really our desire to close that gap, and really through resource creation, partnerships, research, et cetera. And so that led really to the creation of our Health Literacy for Health Equity initiative that you heard about at conference.
So let's talk a little bit about that. That's what got me so excited. Health literacy. It's been such a buzzword. It's been such a need. Maybe before we dive too deep in it, can you give us a quick definition of health literacy and what that means to AHIMA Foundation?
Sure. So, the CDC's definition of health literacy is the degree to which an individual can access, understand, and use their health information and services, either for themselves or for someone else or a loved one. And they also, importantly, in 2020, created a definition of organizational health literacy, which I think is really important in addressing that organizations have a responsibility tied to health literacy. And that is the degree to which organizations equitably enable individuals to find, understand, and use information and services for themselves or a loved one or someone else. So it's really important that these two really, personal health literacy and organizational health literacy, really do go hand in hand, and the solution rests in both of those areas.
I really like how you have married the access problem to what is classically the health literacy problem, because it's one thing to know how to interpret and understand and use my health information. It's another to access it. And the two have to happen in order for me to become health literate, right? We oftentimes just focus more on understanding the information, and we don't really talk a lot about gaining access to it. So I really like how your definition incorporates both sides.
Yeah. You can't understand or use something that you can't access. So access is key. And certainly I think in this increasingly digital world, out of necessity, and as the last 2 years have shown us, I think it really underscores the importance of access.
I think you've hit on something there. As we've become more digital, I think the expectation has gone up in terms of, well, if it's digital, then I should be able to access it, right? Whereas before, if it was a paper document or a paper process, I think there was some understanding that, okay, maybe I can't access it very easily. It's obviously in a paper file folder somewhere. But since we've transformed most of healthcare to digital, now I think the expectation of patients and frankly of clinicians is, well, I should be able to access this stuff pretty freely.
Yeah. Freely, easily. I think it really underscored that there's a big gap in who can access their information. So that's, something we've heard in the news. It was amplified in a way that really we couldn't have predicted, but it really, there's an increasing urgency, I think, to really address this issue of low health literacy. It's a pervasive problem. And, there's an urgent need to address it.
And why is that need so urgent? Like what is having good health literacy do for a population or for an individual?
Sure, sure. Well, certainly every single one of us is a healthcare consumer, whether we like it or not.
Hmm.
And, as I mentioned, health literacy is really widespread, and it's a systemic issue. It really affects tens of millions of Americans. I think 9 out of 10 is a stat that I'd seen. But it also crosses racial, geographic, socioeconomic, immigrant, all kinds of lines, right? It really impacts everyone. It also, I think, disproportionately impacts the most vulnerable in our society. But, it's health literacy is important for a couple of key reasons that I think many of us have heard, but we can't repeat enough. Number one, I think, we all need to be able to understand and use our health information and communicate with our care providers. I mean, really, to make an informed decision about your health and your care, you need to obviously be able to understand and use your health information. And I think, there's lots of statistics out there about, poor health literacy obviously contributes to poor treatment adherence, in many cases, increased prevalence of chronic disease and higher healthcare costs. There's lots of research that substantiates that. For many, I think it's not talked about a lot, but I think low health literacy can also be stigmatizing, right? There's a sense of shame. And so if you're not, I think that can lead to individuals avoiding care altogether in those cases. So I think, it's important for each and every one of us. And as I said, I think it's more than just the measure of individual abilities. It's really about healthcare professionals and organizations needing to prioritize the development of systems and technologies and interventions that really address, that are really consumer-centric, that really address this problem.
I totally hear you on that, especially around what you talked about. And if I am more familiar with the health data about me, then I have a little bit more trust about what's happening with my care, because I'm going to be more informed. I'm going to be more up to speed on what's being recommended for me. I won't be as afraid, which I think, to your point, that fear drives people or keeps people away. They won't participate in their care, as opposed to using health literacy for something else. What I mean by that is, I think when you don't have it, I agree that people just don't come in. And that's a bigger problem, because then they'll wait until they have to go to the ED, right? Which we know is the worst place to enter the health system, right?
Yes, exactly. Yes, and too common, unfortunately. But yeah, trust is really the cornerstone, with regard to consumer engagement, and knowing that your data is secure, knowing that you trust the information that you're seeing, and to be able to really engage in your healthcare is really key.
So let's pretend for a moment that the foundation achieves all of its goals with this health literacy project. What does that world look like?
Yeah, that's a great question. Well, so for the past 20 years, I think healthcare has really moved closer, I think, to this idealized vision of value-based, patient-centered care. But I think, technology advances certainly, and process improvements and regulations, I think, have all, contributed towards this vision. But health literacy, health equity, and consumer engagement, I think, really are critical to take us really towards that vision and take us all the way to that vision. And our goal is really to help consumers, as I mentioned, really access, understand, and use their health information with confidence. And we want consumers to become collaborators in their own health and care. So achieving our goals really means a few things, Colin. One is every health consumer will have the capacity to access and interpret their health information with confidence. Two, every consumer will be an advocate for their own health and a collaborator in their care or for a loved one. And then importantly, every corner of the American healthcare system will prioritize systems and information and technology really dedicated to helping consumers become their own best advocates for health and care. I think everybody recognizes the importance of it, but often the resources and the commitment to follow through on that to really make an appreciable difference in addressing this pervasive health literacy problem isn't always there. So that's a critical piece of it as well. So that's what success would look like, individual and systemic. And
again, I love that third bullet that you mentioned there. We're having to prioritize it is part of the goal, because it's one thing. Again, health literacy is one of these things that we'll never solve it. It's an ongoing thing, and so we have to make sure we prioritize it. To your point, I love that that's part of your end state goals that you're trying to achieve.
Yeah, thank you.
So, one of the things that we hear a lot about in terms of improving health literacy starts in schools. And usually that discussion goes to, the K through 12 system, which I view that as it's definitely important, but it's also long term. I mean, that's not going to help us tomorrow in terms of raising health literacy overall. I mean, it certainly will help, but it's more of a foundational element for the future in my mind. Is there anything that we can do as health IT companies and healthcare organizations, or just individuals who are really just passionate about this? Is there anything that we can do to kind of help with this, with improving health literacy?
Yeah, you make a really good point. I think, there's a longer term, and addressing this issue. I kind of, the parallel to financial health literacy is certainly there, right? So that's really consumer centered and consumer serving. I think, it's a complex and enormous challenge to your point, Helen, and it really requires complex, innovative solutions for consumers. And so I think momentum is really essential to our success. What we're really trying to do is we're looking for strategic partners, allies, health literacy and consumer engagement experts to really help shape our initiative, identify potential partners, and share their success stories. There are a lot of organizations working on this issue from different angles and different aspects of health literacy. And it's going to take, a concerted force of all of us, to really find solutions that truly serve consumers.
Right.
And, and I believe wholly it's possible. And certainly recent regulations, I think, more power will be put in the hands of consumers. And just like financial literacy, right, it's our obligation, I think, to find tools and to build systems and processes that really do serve the best interests of consumers. And we're looking for people who care about this issue as much as we do, who have the same values around this issue, and who really want to make an appreciable difference in, in this problem.
Well, on that note, during the conference, you came out with an announcement that you had formed a steering committee for your health literacy program. Can you maybe walk us through that announcement and what that means for your program?
Sure. Yeah. Well, the steering committee, is important in that it represents a wide range of individuals that are looking at this problem from various perspectives. So we have educators and researchers. We have practitioners who are doing, work locally to address this issue in a real substantial way. We've got other association professionals, who have also touched this issue and are making an appreciable difference. And I think, we all approach this work with humility, and it's important to create an avenue by which to learn and by which to, really maximize our impact and our efforts. We're not the first to obviously address this issue. We won't be the last, but we want to make sure that we're bringing the experience and knowledge and expertise of those who've been working in this space to really help not only shape this campaign, but also to help inform their work. And so, it's important, just as none of this work happens by individual organizations. Partnerships and collaborations are key to creating any kind of social change. And so that's really the idea behind the steering committee, and who we've asked to participate. And I'm thrilled, they've said yes. And it's been really important just and even to launch our most recent campaign.
Well, and it's interesting you say, diversity was something that struck me as I looked at the individuals that were on that announcement, and they were not all from health systems, and they were not all sort of experts in this field. They did come from a wide variety of backgrounds, and I guess that's by design and also by choice in terms of who you were able to attract. That's a testament to that.
Yeah, those varying perspectives are so key, right? To really, that diversity is fundamental to what we're trying to accomplish. And it's also, we try to be as representative as possible, and to bring these diverse perspectives as we're creating programs. And, so that's definitely the idea behind who we asked. And, so our work is just starting, but many of these folks on the steering committee have been working in health literacy for a long time, and have done great work and will continue to do great work. And we're just thrilled to be collaborators and partners with them on this journey that the foundation's on.
So just pretend for a moment that I'm a person that's not in healthcare. And so if I was like, let's say a leader at a banking institution or a teacher or someone like that, what would you say to me to get me on board this health literacy train?
Yeah. Well, I think I would go back to, the fact that either you as an individual or someone you loved, has had to be in the healthcare system, right? And being an advocate for your own healthcare, accessing, understanding, and using your information is critical to your health outcomes. And ultimately, right, that is what's most important, that better health literacy leads to better health outcomes. And again, we've all been patients. We've all been, or caregivers of loved ones who've been patients. And, it's really important to be your own advocate, and to really harness that power and have the confidence and trust to be able to, engage with your care provider and ask questions and question what you're being told and all of that. It's really, really important. And, health literacy and the kinds of information really ranges, right? From
Right.
interpreting a test result to figuring out your bill. And, it's complex, as we all know.
Mhm.
But, being your own advocate, and really understanding your information truly does lead to better health outcomes. And everybody deserves that chance and opportunity.
Right. I think you hit on something that I found so key here. When we're talking about health literacy, we're not talking about turning everyone into a nurse or a clinician. We're talking about some very basics of like, why is it important for you to take this medication 3 times? And what is it actually doing? Right? Like what's it designed for? What's it meant for? Why do I have to wear this cast for, X number of days and not move it and do just simple things like that, understanding that level. And then, like you said, understanding something as simple as a test result and what the key numbers really mean, can really help you better understand what you need to do as an individual to improve or make some small changes that might help your health, right?
Yeah. Yeah. And Colin, I think, outside of the provider setting, I think, our aim is to really provide consumer-centered resources to help you to understand, to help you to ask the right questions, to know your rights, to put you in a better position to be able, when you are engaging with the healthcare system, that you're armed with this information. And so it's actionable information that's actually useful to you, that helps you build your confidence, helps you to be a better advocate. And there's never enough of that kind of information. And I think it's really key that it's really focused on the individual consumer. And
You can tell we're having a good conversation here, Anisa, because you're answering the question that I was going to ask. Like, so what does the foundation put out? Because I went to the website, and you do have some of these tools available to the public, like the how to ask questions and those kinds of things, where I can just, as a member of the public, just go ahead and use them.
Sure. Yeah. Yeah. So our initiative, Health Literacy for Health Equity, it's a multi-year initiative that's really designed to, as I mentioned, nurture kind of solutions that are really based for consumers, caregivers, advocates, but also as well as healthcare providers and community stakeholders who really care about this issue of health literacy and access and equity. So we're about to launch the Better Health is in Your Hands campaign. That's really the centerpiece of this initiative. And the goal of the campaign is really to empower individuals to exercise greater control over their health information. And so the primary hub of the campaign is a microsite where you as an individual consumer can find and download credible content and resources, again, to better access and understand your health information. So we're launching this very soon, next week, in fact, and we're going to continue to add content to it at a rapid clip here. But I think there's a lot we take for granted, and I think this information is meant to be accessible and usable and helpful to individual consumers. So that is our main focus now, is to launch this site and to amplify that amongst with our partners at the community level, as well as through the digital channels as well.
Well, we're getting close to the end of our time here, Anisa. So let me ask you this final question. Where can people go to find out more information about the foundation and the work you're doing?
Well, please visit us at ahimafoundation.org. There you'll find a link also to this site that I mentioned about our campaign, and you'll be able to find the information there. And we welcome your engagement, and please reach out to us if you're a healthcare provider, partner, etc. We'd love to talk with you. Please reach out to us, and we look forward to working with you.
Awesome. Anisa, thank you so much for your time and for sharing all this wonderful information. Good luck to your initiative. It's so needed. Really appreciate it.
Thank you, Colin. Great to be here.
Hey, if you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give a review on iTunes, YouTube, or wherever you're listening and watching this. Also, head over to healthcareitttoday.com to access our free resources, industry news, and insightful articles. You can also connect with us on Twitter using the hashtag HITSM. I'm Colin Hung. Thanks for being here.